And so I'm thinking about contact for end of cases. I know that we're always shooting for at least a 3-to-1 award or greater. My question is, in Florida, it's very common for the attorney to not want to give the proposed disbursement of settlement. So if that occurs, I mean, I know that obviously these in the past I haven't done, the PI sales presentation. But if that happens and it's like, well, that's just confidential, then is there a procedure that we should go through at that point? If they're like, well, there's 16,000 in medicals and the settlement was 30,000. So therefore, the 3-to-1 wasn't met. But how do I know if it's not like a, $2,000-$3,000 MRIs that the MRI center hasn't been
Yeah,
done yet?
also just so you know, it's 3-to-1 medicals, not the totality of all 4 potential injury awards.
Oh, right, yeah. So yeah, it would be the medicals, the patient, and then the attorney.
Let's get back to the topic that you just brought up. You have to understand where your intent's coming from also. Now, remember, every one of your patients should be signing a limited power of attorney. You know that, right?
Even if they have an attorney.
Yeah.
Yeah.
Yeah. You always have them sign. That gives you access, whether they want to give it to you or not.
Okay.
Okay. That's the legal document to get access to anything that patient has access to, you have access to. That includes the injury award. Now, I'm not referring to coming at the attorney from an adversarial position. That is not why we want to know the injury award. The reason we do is we want to make sure, remember, there's 2 things I said you should do after every case. You remember what they were?
After every case.
Yeah.
You probably want to touch base with them, make sure that, hey, was there
There's 2 questions you always do. Number 1, were you satisfied with the injury award? Was it what you expected? Did you at least get a 3-to-1 or greater? Now, if they don't want to tell me, that's fine, but what's my motive?
to be able to help them?
Yeah, it's a different motive. I'm coming at it to letting them know I'm trying to help you. So that's number 1. Number 1, I want it to, number 1, did you get what you expected? And was it at least a 3-to-1 relative to medicals? Number 2, was there anything else in the documentation we could have done better? I just told you gold. If somebody did that to you after every case, how would you feel about them?
That they're on my side.
How would you feel about working with them again?
Much better.
How would you feel about referring to them again?
Better.
I just told you gold. Nobody does what I just told you. Chiropractors don't do. I'll ask a chiropractor, I'll say, well, how much did the case settle for? They go, well, I don't know. They only give a damn what they get paid. Well, that's a good way to destroy relationships. Go ahead and treat your wife like that and see how well that goes. You only give a damn about yourself. See how well that relationship goes. No, you actually have to pay attention to the person that's actually helping you and feeding you patients. You got to actually want to help them. So yeah, that's what I always do. Hey, number 1, did you get what you expected? Was it at least a 3-to-1 or better? If not, why? And hey, what documentation could we have done better? If you're doing all the documentation like what they'll teach, they'll just love it. They'll go, oh man, your stuff's the best, because they haven't seen anything like what we do,
Yeah. I'm listening. I'm just writing notes.
Yeah, what they'll do, what they may do, they won't say, well, you could have added this or that. That's not what'll happen, because our documentation just blows them away. What they'll do is it'll be a format. Well, I could have had it earlier, or if you could have let me know earlier, if it'll be something minor if they say anything at all. That's kind of what happens with our clients who've been trained in personal injury. But that's the 2 things you always want to say. Hey, just want to see how the case went for you. Did you Did you get what you expected? Or did you get at least a 3-to-1 injury award relative to medicals? And what could we have done different to help you with that documentation? Is there anything that we could have done differently? See, even if you didn't do something and you could have, they love it. Again, how would you feel if somebody said, "Hey, what could I have done better to help you out here?" You're like, "Whoa, I'm not used to hearing that. I'm used to hearing doctors bitching about when I ask them to cut their bill." Well, who do you want to deal with? Somebody gives you good documentation that gets you a 3-to-1 injury award and says, "Hey, did you get what you needed? And is there anything else I could have done better?" Or do you want to deal with a doctor that gets you a 2-to-1 or less injury award and bitches when you ask them to cut your injury award or your bill? Who do you want to deal with if you're the attorney?
Yeah, the person who's communicating and is willing to improve if need be.
Do you see how easy it is to stand out compared to the competition, the chiropractors out there and what they're doing?
Mm-hmm.
It's not even marginal. It's like black and white what we do with versus what they're doing. It's not even in question.
And would that be that would always just be a phone call, or do you want to have that like documented in like an email?
No, no, no. That's going to be a phone call.
Okay,
And
and
a lot of times that's when it is good to do lunch. You always hear me say, don't take them out to lunch. You don't get anything done at lunch.
yeah,
That's when it is good because that's a casual setting. You're not trying to educate them. You're not trying to sell them. You're not trying to create a referral. So that's actually a good time to take them out to lunch. Say, "Hey, let me take you out to lunch. I'm talk to you about how the case went. See if we could have done anything better." That's when it's a great time to take them out to lunch after the case is settled and talk about the case. Okay, did you get what you want, the injury award? What could we have done better with the documentation? I'm telling you, they love that. Nobody does. You know why doctors don't do that?
they're intimidated.
They're intimidated, but why else do they not? Why did you not do that?
I guess afraid of the feedback of getting the honesty if your documents suck.
You didn't know your documentation. You didn't know.
Yeah, before I started, yeah, I didn't know.
Right. You didn't even know if you were doing what you were doing was right or wrong or good or bad. So a combination of not even knowing and then being intimidated, there you go. But no, when you know all this documentation, there's no reason to be intimidated. It's like head and heels over everything. Doesn't even compare to anything they're getting. So yeah, that's what you want to, that's exactly what you want to do. I did that with every case. I just called them, said, "Hey, did the case go as you want? Did you get a 3-to-1 relative to medicals?" In other words, my bills relative to medicals. And by the way, it's like you said, it's my bills relative to medicals. It's really medicals in general, but I'm not going to include it if I see a lot of crap diagnostics that were stacked on it. But generally speaking, it's all the medicals relative to your bill should be 3-to-1 or greater.
Oh, just my bills.
Yeah, your bills, yeah.
Okay, so
Yeah.
we're not counting it.
Yeah, because you can't control anybody else's diagnostics and therapeutics. But your documentation, yeah, with your documentation, they should at least get a 3-to-1 of the medicals in your ward relative to yours. That's what it should typically be. And the case should get a 3-to-1 anyway, if there was other documentation. But you already know they're getting a lot of crap. They're getting a lot of bad stuff, a lot of bad documentation, worthless documentation, high bills. They get a lot of crap. But yeah, that's you want to seal the relationship at the end of the case, take them out to lunch and talk about the case. Say, "Hey, how'd we do? Did you get what you want? How did that work out? What could we have done better?" Gold.